Hi, my name is Cindy Wood and I'm the Executive Director at Vintage Brush Creek, an assisted living and memory care unit here in Santa Rosa, California. Thank you all for coming, and I'd like to welcome you to Vintage Brush Creek's joint venture with Cheryl Fox and Associates titled Medicinal Marijuana Through the Ages and As We Age. We at Vintage Brush Creek abide by all federal and state regulations that pertain to our community, including federal laws prohibiting growing or storing of marijuana. Nor do we encourage the use. However, we also believe in modern medicine and the scientific data that supports the beneficial uses of marijuana in Alzheimer's, dementia, and several other diseases that affect our aging population. Please join me in welcoming Dr. Philip Grob, MD, to further this discussion.
Hi, my name is Philip Grob. I'm a psychiatrist in Santa Rosa, California. I've been here about 10 years as a practicing psychiatrist in the community. I'd like to thank Vintage Brush Creek and Cheryl Fox for the opportunity to discuss the potential medicinal uses of cannabis. The reason I'm interested in giving this talk is that cannabis is still in the federal government classified as a Schedule I substance, which indicates that it has no therapeutic potential. However, in the state of California, as well as 19 other states, cannabis is allowed to be utilized medicinally, and as many of you may know, recently in the states of Colorado and Oregon, the states have voted to allow cannabis to be used recreationally. So cannabis has numerous medicinal uses. We've known that it's been helpful for nausea and vomiting in association with chemotherapy, as well as HIV wasting disease. However, more recently we have found through our clinical practice that it can have a robust therapeutic effect in helping individuals with dementia and consequent agitation. I'd like to discuss some of the concerns and risks we have with the traditional allopathic pharmacopoeia that has been utilized to help this condition, and what the potential benefits might be of utilizing cannabis, either in addition to or instead of psychopharmacologic agents. During my talk, I'd like to discuss the historical precedents of cannabis, which has been used since ancient times, as well as the developmental uses, that is, the effects of cannabis, both positive and potentially negative, as we age. I'd like to keep this discussion open and answer any questions that the audience may have. With regard to the audience, I'd encourage anybody who has family members who have chronic pain or complicated dementias to attend, as well as individuals who may be interested in utilizing cannabis as part of their medicine treatment. I know that there is a strong federal government conditioning that has impacted our concerns and fears, and I hope that as a result of my discussion I might be able to shed some light and clarity on the potential therapeutic uses of cannabis. I hope you attend. Thank you.